Hello everyone, this is Dr. Peter Lee, along here with my friend and colleague, Dr. Ben Lee, and today we'll be talking about HBOT, Hyperbaric Oxygen Therapy. So, you trained at Duke, so you kind of know what the hyperbaric oxygen chamber is. Maybe you can just tell us the overview.
On the East Coast, it was the Center for Treatment of Decompression Sickness. For divers, if they came up too fast, they would fly people in. Being able to carry more oxygen in the blood is very helpful. And we really cannot carry more oxygen in our blood unless we do so at higher atmospheric pressures, and that's what hyperbaric oxygen does. We're at higher atmospheric pressure, so your blood can carry more oxygen to help the tissues heal.
I mean, certainly we know that oxygen is critical for pretty much a lot of the things that we do at a cellular level, right? Every single cell in your body needs oxygen. And the main pathway for carrying oxygen in our blood is the hemoglobin that exists in our red blood cells. And so sometimes that is the limiting factor, right? How much hemoglobin capacity do we really have? And that's what hyperbaric oxygen does, is that not only does it deliver 100% oxygen, but it also puts people at a higher atmospheric pressure so that actually the oxygen dissolves into plasma. And it can increase people's oxygen carrying capacity by 10 to 20 times the normal. So what's the benefit of actually having a lot of oxygen that is circulating in your blood?
Well, obviously, the more oxygen we have in our bodies, the better our cellular processes are. And you mentioned gases being dissolved in blood or fluid. I mean, it was a big evolutionary advance to be able to have this molecule to carry more oxygen. Before that, we had to rely on just whatever oxygen we could get dissolved in the gas. But just being able to dissolve more is just beneficial for all our cellular processes.
Certainly, I mean, enough studies have shown that it actually affects a lot of things. That number one, it increases the number of mitochondria in your cells, that it increases actually stem cell, in your system. It seems to actually have effect at the immune system as well, where it seems to actually promote increased immunity, but at the same time, decrease inflammation as well. So, how often do people need to be in hyperbaric oxygen?
Well, as you said, obviously you can't live in a hyperbaric chamber, but if hyperbaric oxygen switches on certain gene expressions, you don't have to be in it all the time.
Yes. And that's what seems to sort of be the consensus with all the studies, right? And so our usual protocol now is at least 2 to 3 times a week for about maybe a total of 20 to 40 sessions. And then thereafter, it really kind of depends upon the patient's kind of desires, but perhaps as a maintenance, do maybe once or twice a week, every month or two.
Yeah, I really can't see a negative other than the time it takes to get these treatments, but I think it's worthwhile.
I mean, it seems to be pretty powerful, at least at the molecular level of the changes that occurs.
And genetic level, as you said.
And profoundly, it seems to really work very well in reducing that chronic inflammation that we talk about a lot.